नमस्कार, मैं हेमलता आज फिर टेलीकॉन्फ्रेंस की एक नई कड़ी लेकर आपके समक्ष उपस्थित हूँ। अभी तक हमने भी डिसेबिलिटीज़ के अर्ली आइडेंटिफिकेशन और रेफरल के विषय में जानकारी प्राप्त की। आज से हम डिसेबिलिटी के इंटरवेंशन और रिहेबिलिटेशन के विषय में अपनी कड़ियों की शुरुआत करेंगे। अभी तक हमने जाना कि विकलांगता की पहचान कैसे की जाए, उनके लक्षण क्या हैं और कहां-कहां पर रेफरल सुविधाएं उपलब्ध हैं। पहचान हो जाने के बाद एक स्वाभाविक सा प्रश्न माता पिता के दिमाग में उठता है कि अब क्या किया जाए। ऐसे बच्चों के लिए जिनके बारे में पता चल चुका है कि उन्हें कोई डिसेबिलिटी है, अब हम कहां जाएं और क्या क्या किया जाए। ऐसी स्थिति में माँ बाप क्या करें, यही हमारे आज की टेलीकॉन्फ्रेंस का विषय है। श्रवण विकलांगता के इंटरवेंशन और रिहेबिलिटेशन के लिए हम क्या कर सकते हैं, आइए जानते हैं अपने आज के विशेषज्ञ से। मेरे साथ हैं श्रीमती कनका जी। आप मणिपाल एकेडमी ऑफ हायर एजुकेशन में सीनियर लेक्चरर हैं। मेरे दूसरे विशेषज्ञ हैं श्री पीटर वर्गीस। आप मणिपाल एकेडमी ऑफ हायर एजुकेशन में लेक्चरर हैं। Before I request the experts to give their valuable information on intervention and rehabilitation, kindly note our phone numbers so that you can ask questions. Our numbers are, toll-free number is 1600112345. STD number है 01129532844, 01129532845। एक और STD नंबर है 01129536131। आप फैक्स के द्वारा भी अपने सवाल पूछ सकते हैं। हमारा फैक्स नंबर है 01129536134। Mrs. Kanka, would you tell us something about oral rehabilitation and importance of early management?
Good morning to all our viewers. Now today the topic that we know that we have taken it for the discussion is on intervention and rehabilitation for the hearing impairment. Now this term is also otherwise very popularly known as oral rehabilitation. So we'll just see first what is oral rehabilitation. Now oral rehabilitation means these are the services and the procedures that we normally employ for facilitating the receptive or the understanding ability and the expressive communication, especially for the individuals with hearing impairment. So the ultimate aim that is there when you do this oral rehabilitation is to maximize the communication that is there for a hearing impaired in everyday environment and in situation that we need to maximize it. Now, so the ultimate aim that you see, like the key word for this is communication. Now, जब हम communication कहते हैं, so it means that you share ideas with one another. Okay, that is what we call it as communication. Now, this particular aspect gets impaired in a hearing impaired individual. तो इसके लिए हम क्या कर सकते हैं? It is need not necessarily that हम एक modality जैसे language में ही we try to emphasize, but also we can use any other mode for communication. Now before we go on to the early management, we will just see some of the problems that the hearing impaired will face because of his hearing problem. Now what are the problems that they normally face? Now they can have a problem in communication, they will have problem in learning, and they will not be independent, they will be more dependent, and they will be so unsure, and they will have a fear for talking others, they will isolate themselves, they will be depressed. So these are some of the problems that you can see when you have a hearing impairment. So why we need to do early management will address this question of improving these aspects which in which they feel deficit is there. Now why we need to do an early management? Now for doing early management, we know that the first step that involves is early identification. Okay, so we, like आप slides पे देख सकते हैं. Now why we need to do an early management? The first important reason is if you do early management, we'll give a chance for them to have a better speech and language skills, and also we can improve their social, educational and occasional placement, and the gap that is existing between the chronological age and the language age also can be reduced. Now when I say chronological age, इसका मतलब होता है कि the actual age of a person, and the language age is मानिए कि like suppose if you get a child of 3-year-old, that is the age of the child, actual age of the child. But if the child just utters only one word, that means the child's language age may be around 10 months to 1 year. So there is a gap that is there between the actual age of the child and the language age of the child. So when we give this management, we try to reduce this gap. So if you do this early intervention, then you can reduce this gap that is existing between these two ages. Then also they say that when you do this early management, it helps you actually in like making the person to give a chance for him to learn language, to communicate more effectively. Now when you say to communicate through language more effectively, there should be some optimal period, okay, for learning the language. Now this optimal period for learning the language initially was considered, or it is called as the critical age. और इस age जो होता है जो around puberty के time तक, that you can do an optimal time for learning the language. लेकिन when you say that it is an early management, तो तब क्या होता है कि optimal period तक wait करने से it may not be like you can give training. It is not that we don't say that we cannot give training, लेकिन the amount of energy that you are going to be spending is more. So there is something called a sensitivity period. जो sensitivity period means those period में where you can learn the language more quickly, more easily, with less effect, and you will be able to learn the language effectively. तो slides में हमने दिखाया है अभी आपको कि the sensitivity period for learning the language is till 3 years of age, even though till 12 years we say that it is a critical age. So 3 years तक is a best time. Within that, if you can start the intervention, that is one of the best way. But how early we can start intervention? Now how early means, now we know that from the previous presentations and all, like we can identify the hearing loss by birth itself. So when we identify the hearing loss by birth, and if you are able to give a hearing aids to an individual by at least 2 to 3 months, क्योंकि this is a child that we are going to rehabilitate, so थोड़ा time लगता है, like in one setting we cannot just prescribe a hearing aid to them. So the latest the rehabilitation, if you are identifying at birth, can start by 4 to 6 months of age. It can start with.
Thank you, Kanaka. Mr. Peter, what are the steps in oral rehabilitation? Would you tell us something?
The oral rehabilitation procedure has got several steps, and these steps can be broadly classified into 4 categories. That the first category is the counseling aspects, amplification aspects, communication training, and the overall coordination of these activities. The counseling is the first step in any oral rehabilitation procedure. In this counseling, what we do is the audiological findings are explained to the client or other significant family members. The information is given in terms of degree of hearing loss, the type of hearing loss, and the configuration of the audiogram. And the information is also given about the possible management options. Again, we will give information about the educational, psychosocial, and communicative effects of hearing impairment. That is, how hearing impairment affects the education of the child, how the psychosocial development is affected because of the hearing impairment, and how the communication is affected because of hearing impairment. All this information is given to the parents of the child. Next, we will give information about language development and hearing, the relation between hearing and the importance of hearing in language development, and how a hearing loss can affect the language development of a child, and the auditory training and language training. So after the identification of the hearing impairment, it is necessary to give auditory training and language training. Auditory training includes activities to improve the listening skills of the child, and the language training includes the activities for improving the language skills of the child. And the next step is choice of education and choice of language. The information is given about these two aspects. This becomes very important for a prelingually deaf child. The choice of education includes whether the child wants to go for a regular school or a special kind of education, or choice of language is a language in which the parents want to communicate with the child, and the language of the training and language of education. So these two decisions are the combined decision of the family. When properly done, the counseling leads to acceptance and understanding of the problem and the appropriate expectations for remediation. The next step in rehabilitation procedure is the amplification selection. Soon after the hearing loss is identified and after proper counseling, it is necessary that the child should be fitted with a proper amplification device. This could be a hearing aid, a cochlear implant, or any assistive listening devices. So assistive listening devices can be used to supplement the hearing needs of the child in particular listening conditions. The selection of these amplification devices depends upon the degree of hearing loss, type of hearing loss, and the configuration of hearing loss, as well as the listening needs of the patient. It is necessary that we have to explain the purpose, function, and maintenance of hearing aid. That is why the hearing aid is being put, and how does it work, and the maintenance, how to maintain the hearing aid, along with the information regarding the troubleshooting of the hearing aid. Next step is amplification adjustment. That includes the fine tuning of the hearing aid based on the needs of the patient. That is, for that a regular follow up is required. The next step in rehabilitation procedure is communication training. So in the first in that is learning how to listen. The technological devices, that is hearing aids or assistive listening devices, gives access to hearing, but the use of this hearing depends upon the training. So in this step, the learning how to listen, we are training the child how to listen. And the next step is learning skills in speech reading. When an individual doesn't get enough information through the auditory modality, that is with hearing aid, if the individual is not getting enough information about speech, it is necessary that it has to be supplemented through other modalities. So speech reading includes the visual mode of perceiving speech. So this includes lip reading and the comprehension of facial expressions, gestures, and body language. Next, we have to build confidence in handling communication situations. So the patient should be counseled regarding how to handle the confidently the communication situations. Next step is we have to tell the patient what to do when the person doesn't get the message. That means when there is a communication breakdown occurs, what has to be done. This includes the strategies which has to be used when there is a communication breakdown. So next step is learning about the different technology to improve communication. This includes assistive listening devices. That is, in a particular situations, the hearing aid may not be that helpful in understanding speech. So assistive listening devices also can be used in perceiving speech in some particular situations. And next is learning what are your rights under various laws. According to the various laws, what all are the rights of the hearing impaired individual. This information is also given in this step. And learning how you can make it easier for your family to communicate with the individual. Okay? These are in brief about the rehabilitation procedures for hearing impaired.
Thanks, Mr. Peter. Ms. Kanka, अब आप हमें ये बताएं कि बच्चों को लैंग्वेज और ऑडिटरी ट्रेनिंग किस तरह से दी जाए?
Yes, ma'am. Jab once the hearing aid is fitted, that is the first step that is done. Once the hearing aid is fitted, many times we think that as soon as we fit the hearing aid that the child will start to speak on its own, but that is not true. Usually parents do have that kind of an expectation. So once the hearing aid is fitted, before you go to the language training, it is necessary that you give something called as auditory training, और उसको listening training भी कहा जाता है, or sometimes also referred to as ear training. Now what is this auditory training? It means to say that once you have fitted the hearing aid, actually what happens is that the kind of sound that you are going to hear is not that is similar like how we normally hear. the quality of sound that you are going to hear through a hearing aid is going to be different. And since we are going to deal with young children and all who have never been exposed to any sounds that is present in the environment, it is necessary for us is that once you fit the hearing aid, we need to tell, okay, what is the sound. Okay, suppose if there is a doorbell ringing or if there is a telephone sound, they don't know which is the sound, they just hear all sounds as similar. So we need to tell them, okay, this is a telephone sound and this is a doorbell sound, or whatever the sounds that is present in the environment. So when you do this, this is called as you are actually stimulating the hearing mechanism, or you are trying to use the whatever the remaining amount of hearing, that is what we call it as residual hearing, to its fullest capacity, that you are going to maximally utilize the little bit amount of hearing that is remaining along with the amplification. So here this auditory training or listening training, normally we do it in step by step manner. Can we just show the slides please? Okay, so here we see the steps of auditory training. Here only we have mentioned few of the steps, there is also further steps that you can do. So the first step that you see is what you call it as the awareness. Okay, so awareness means it is an ability to actually say whether the sound is present or not present. That is the first step that you have to do. So once a hearing aid is fitted, you present stimuli and the child just have to say yes. If the child hears a sound, maybe just you can ask them to put the blocks down, or say just make an indication that yes, you have heard some sound. So that is the first step that is involved in auditory training, awareness. After awareness, you have something called as localization. Localization means it is an ability to perceive the sound from where it is, the direction from which the sound is coming. Now in a normal hearing also we see that when somebody calls you from right side or left side, we tend to turn towards the kahan se jab shabd aata hai, we tend to turn towards that side. So similarly, a hearing impaired child also needs to be taught from where the sound is coming. Now this will be possible only if they are using both the hearing aids in the ear, then you can teach this skill of localization. Then the next step after localization is discrimination. When you say discrimination, here what we do, we will present two stimuli and we will ask the child just to say whether it is same sound or whether it is a different sound. Now this can be done either using a non-verbal stimuli, that is whatever the stimuli that is present in an environment, the general stimuli like doorbell or drum or bell, jo bhi the arm stimuli apart from speech jo hai, you can use that as a stimuli, and later you can shift to the higher level of using a verbal stimuli also. So the child just has to say whether it is same or it is different. So after this step of discrimination, the next step that goes is the identification. Identification means it is an ability to label whatever the objects that we have named. Suppose if we say that after the discrimination, suppose I tell it is a pen. Okay, so the child may be expected to point where the pen is. Okay, or give that particular objects from 4-5 objects that you have kept in front of them. So that is the identification, either through pointing or labeling whatever we have spoken to them. Now after this identification, the ultimate thing that we want is the child to understand the language. So this is an ability to comprehend whatever we have spoken, the language spoken, that is called as the comprehension. इसके बाद भी steps होते हैं, लेकिन these are some of the basic steps that you need to do before you go to the language training. So once auditory training has been given, the next step that goes is for the language training. To do a language training, there are various methods that are involved in giving a language training. Here we have classified it very grossly. Can we just have the slides? So in the language training, what we see, there are two approaches that you can do in order to improve the language. One is called as the natural method and another is a structured approach, and both these methods can be either worked using one modality, we call it as unisensory modality, or when we use different modalities to help them to speak, then we call it as the multisensory approach. Next slide. Now what is natural approach or the natural method? When you say it is a natural method, it means that we are going to teach the child like how we teach the other normal children to speak, we are also going to teach them in that similar way, and we will also teach them in the pace or the speed in which the child is picking up language. maybe the child may not be interested today, and tomorrow the child may actually like may be interested. So that time we will stimulate the child more, like how we teach a normal child, similarly here also you are going to teach them. And here we will also like see the needs for the child. ये नहीं कि we will teach जो भी like we are seeing सबको हम सिखा देते हैं, whatever the child requires in the immediate environment में, जैसे child को कोई immediately को चाहिए होता है, जैसे खाना चाहिए होता है या पानी चाहिए होता है. So these kind of important things are first given more important, and then we would go to teach the other things. Okay, so this is called as the natural method. So the advantages of this method is that it is a very as the name itself suggests that it is a natural way of teaching a language to the child, which is a very good method, and it can be practiced anywhere by anybody, like parents also, since it's like how you teach to a normal child how you speak, you are going to speak. So parents also, caretakers, anybody can be involved in giving a training to those children. Okay, so this is a very like you do not have to come to therapy clinic, maybe you just have to just make sure we will tell them that you speak like how you speak to other children. But there are also disadvantages that comes when you say it is a natural method. The disadvantage is that since we are going to give them training as per the needs of the child and as per the pace of the child, this is a very slow procedure, like you may not see an improvement like immediately, like my child will speak. You may have to wait for a longer time to see a fruitful result. Okay, so it's a very slow pace of learning, and when the child learns also, we may not correct the child immediately. So these people may not pronounce certain sounds correctly, and their intelligibility of the speech may not be that good as you expect like any other normal child. And then these children, since we are going to teach at their own pace and everything, the grammatical component of the speech, like grammar, we use all this correct strilling, pulling and all those singular, plurals and all. So all those things may not be like the child may not pick up correctly. And main important thing is that it lacks face validity, because we have seen many patients who come here like, and if we tell them that you speak like how you speak to a normal child, they will say, that we were also doing when we were at home, but what is different that you want to teach like for my child. So that is one of the main reason, like this natural method many times it is not popular, is because of this lack of face validity that we have. Okay, so this is some of the things of advantages of disadvantages of going for a natural method. But there is also other approach that you can use, which is called as the structured method. Structured method may what happens is that, as you can see here the language is going to be taught in a very systematic manner. That is, you will take the child, okay, I will teach you this vocabulary, then tomorrow you will try to combine that vocabulary to make it into a short sentence, phrases, then you combine to make it into sentence, and you are going to introduce the grammar also, proper grammar, like how you teach a normal grammar, no, like how you learn in books and all. Similar way here also you are going to structure your environment in such a way that the child will learn how to use grammar, when to use grammar, all those skills are taught here. So the advantage of this technique is that the child ultimately learns have a very good grammar, and the improvement that you see in the child is also the language that the child will learn will be much faster. But the disadvantage is that it is very formal. Okay, this technique will be very formal, like how you sit and tell, okay, this is this, next you tell, and we make the child to mug up whatever the skills that you want to tell them. So this is too formal, and many times what happens, the child will learn only in the therapy situation whatever the child has learned. The child will become too dependent on the situation that outside when it goes, the child may not learn to generalize it to the other situations. So this is something brief about the natural and the structured approach. I also told you that it can be used either in a modality of like one mode only can be used, like we know that for speech, to understand speech we can use, normally we know that auditory modality is used, but also there can be like visual modality can be used, or we can also use the tactile modality, that is to touch and all. So apart from these three modalities, the most commonly what they say is you prefer is the combination of the auditory and the visual mode. Okay, so now what is the advantage of having a multisensory approach? So when you combine more than one approach, it is called as multisensory approach. Now what is the advantage? Now even in normals also what we see, Now, when you are in some kind of an environment and you see that there are a lot of sounds that are present in the environment, like when we go for some kind of a parties or anything, there is so much of sound that is occurring. So, that time when you are communicating with one another, it may be difficult, like to say, like you may not understand somebody else's speech, or it may not be sufficient. So, what we will do, we will try to look at the person's face, his expressions, bodily expressions and the facial expressions, and we will try to understand the speech. So, the advantage of multisensory is that the cues that you get, which you may miss through the hearing or the auditory modality, can be supplemented with other modalities. So, the person actually will not miss any information if he uses the multisensory modality. So, that is why we prefer multisensory in a setup also in dealing with the hearing impaired. But many times what happens is, hearing impaired individual we are employing, but the disadvantage of this technique also is that these people, we know that hearing is the weakest of all the signals that they are hearing. So, these people, what they will do, once you start presenting the other modalities also, visual or tactile, these people will ignore their auditory stimuli and they will mainly concentrate on their visual stimuli more. So, what happens is that when you are concentrating on only one modality, the perception of speech or the understanding of speech may not be proper. They will definitely miss out some amount of information, because each modality has their own, like what all the things that you can perceive, and auditory is one of the best modality that you help you in perceiving the speech. So, since these people ignore it, it becomes very difficult for them to understand the speech in total.
थैंक यू कनका। मिस्टर पीटर, क्या हियरिंग इम्पेयर्ड बच्चों को डील करने के लिए कोई नई अप्रोचेस हैं जिनका हम फ़ायदा उठा सकते हैं?
There is a recent approach in dealing with hearing impaired children. This is called as auditory verbal therapy. It is a recent approach in dealing with hearing impaired children, and it is a unisensory approach. That means only one modality is used in training. Okay, this is primary input in auditory verbal therapy is in the auditory modality. The basic rationale of this approach is that improved technology of hearing aids gives sufficient hearing potential to develop language. With the improvement in technology of the hearing aids, the hearing impaired individuals get sufficient auditory input to develop language. Hence, the usage of this hearing depends upon the training. This training is given in the auditory verbal mode, that is only in oral mode, that is only auditory verbal mode. The prerequisite of auditory verbal therapy is that the training should begin early, before 3 years of age. This is mainly because of the sensitivity period. That is, the language is learned better in the early few years of life, and the language is learned with the greater difficulties when this age is crossed. And any young child with any severity of hearing loss can undergo auditory verbal therapy. Hence, the degree of hearing loss is not a factor which affects the candidacy of auditory verbal therapy. That is the age at the detection of hearing loss. So, any young child with any degree of hearing loss can go for auditory verbal therapy. The principles of auditory verbal therapy, this includes detection, that is detection of the hearing loss at the earliest. It is done through screening programs or detailed audiological evaluation at an early age, and the counsel the parents regarding the auditory verbal therapy, and management using the auditory verbal modality, and the integrate listening programs. They support child's auditory verbal development through one-to-one teaching. That is, individual teaching is given at this stage. There is no group teaching. In auditory verbal modality, each child is given individual training, and the child is trained to monitor their own voices and the voice of others in order to improve the intelligibility of their speech, and use of developmental patterns of listening, language, speech, and cognition. It is important in this method because to select age-adequate activities for training, that is age-adequate activities for listening training, age-adequate activity for language training and cognition. And the ultimate aim of auditory verbal therapy is that to facilitate inclusion in a regular classroom. That is the ultimate aim, to go to a regular classroom. Okay. Levels of auditory skills in auditory verbal therapy. This is same as our auditory training steps. That is, first is the detection, that is ability to determine the presence or absence of a sound. Discrimination, that is ability to perceive the difference between the sounds, whether it is the same or different task. When the two signals are presented, the child has to say whether both the stimuli are same or different. Identification, that includes the ability to label what is heard. That is, it can be through repeating what is heard, pointing, picking up the object, or environmental sound perceived. The comprehension, ability to understand the meaning of a connected language, that is the ultimate aim of the auditory verbal therapy. The advantage of auditory verbal therapy is that the parent doesn't have to learn any sign language. It is a normal way of communication, that is through hearing and speech. So the parents doesn't have to learn any other forms of language training, something like sign language or finger spelling. And the parents are back to their natural parenting roles. And it models communication strategies as it is in a normal situation. And the disadvantage of auditory verbal therapy is that this method is purely based on the parental involvement. So the success of this approach depends upon how well the parent carry out the activities at home. And the children in remote areas could not be covered under this scheme because the parent requires to be in constant touch with the professional.
थैंक यू पीटर. मिस कनका, कई बार ऐसा होता है कि ऑडिटरी मॉडलिटीज़ काफ़ी नहीं होती हैं या हम बच्चे को उसके थ्रू नहीं सिखा सकते, तो ऐसी स्थिति में हम क्या कर सकते हैं?
जब when like auditory training or when you are going to give therapy only through auditory modality, like how we saw in this auditory verbal therapy, sometimes it may not be sufficient. Okay, the child may not get all the information because the kind of amplification that you are going to provide to the child will not help him to restore his hearing to normal, especially when you are going to use a hearing aid. So in such cases what happens is that whatever the information that they are getting through the hearing aid and through the auditory modality, that we will substantiate it with the other modes, that is visual mode is also used in order to perceive the speech. So this speech reading, or also previously known as lip reading, it is like the visual mode of perceiving speech is called as speech reading. So in this procedure what is going to happen is that the listener is made to look at the person who is speaking and understand the speech. Okay, that is what is called as the speech reading. So now to do the speech reading there are various variables, okay, that can affect the speech reading. Now the first thing I said is that the person has to look at the person's face and then understand the speech. So the first variable that comes is the put the next slide please. The first variable that comes is speech reading variable. Okay, next slide please. So in that what happens is that now since I told you that you have to look at the other person's face and then understand the speech, the person who is going to speech read, the first thing he should have is that he should have a normal vision, because that is what is you are going to make the modality to perceive the speech. So normal vision is the first important criteria. And the second thing that is that whoever is going to speech read should have a knowledge of the language. It is not that somebody else is speaking in one language and you are in a different language. So definitely you will not understand what that person is saying or what movements of the lips that he is doing it. So knowledge of language is also very essential when you want to do a speech reading. And it also depends on the motivation of who is going to speech read. Now suppose if he is not motivated only, okay, and he is always like he is depressed or his emotional state is not that proper. So that time also what happens is that when he is depressed he may not look at the other person. So whatever the information that he is speaking he will not be able to perceive. So speech reader ke liye you should have a good vision, you should have a knowledge, and also you should be motivated and emotional status should be good to speech read. The other variable is the speaker variable. So in the speaker variable, that is those who are going to speak, okay, it is how they speak also matters a lot if you want to understand somebody else's speech. Now the first point that you see here in this slide is that articulation or the pronunciation of the speaker, how the person speaks also matters. Now some people you see that they have a habit of just keeping their teeth closed or they don't move their lips so much. So in such cases it may be very difficult for us to understand what they are saying. Okay, the movement of the tongue within the articulators like for t or k, like k and all, which is very interior, the person may not be able to look because you are actually keeping your mouth closed and you are trying to speak. So how he pronounces also matters a lot. The rate of speech is also important. Some people they speak very fast. If you speak very fast it may be difficult for us to read the lips also at that same pace. So that rate of speech, if it is slow only, then you can be able to better speech read. The other points is that familiarity of the speaker. Now this is also an important thing, because when you get familiarized with some speakers, then you will be able to better speech read them. But if some stranger comes to you, you don't know how he moves his lips or how he articulates a particular sound, that you may find it difficult to understand what he is saying. So familiarity is also important. The other factor is loudness. हम कितने ऊंचाई पे बोलते हैं. Now people who talk loudly are better able to speech read. We will be able to speech read them better, because when you speak loudly, you will be articulating or pronouncing each sounds more clearly, and also your overall rate of speech also will get reduced. So that is why they say when you speak loudly, it helps you to speech read better. And there are some points, like they say that if you put lipstick, like it enhances speech reading, because you are going to, like since you are going to only lip read them, so this enhances your that whatever the movements that you are going to do. Chewing tobacco reduces the thing, because when you are chewing the tobacco, you may not be able to move your tongue so much effectively, and when you look at it, you may not be able to understand what sounds that he is producing. So chewing tobacco actually reduces the speech reading ability. And suppose if the speaker and the listener, if the speaker himself is a hearing impaired, then since he may have a deficit in language and also in speech, then it will be very difficult to speech read if the other person is also a hearing impaired person. And apart from the speech reading variables and the speaker variable, there is also another variable that can affect your speech reading, that is the environmental factors that can also affect your speech reading. Now these environmental factors are many. Okay, one of the factor is obstruction. Now suppose when two people are talking, if somebody comes and stands in the middle, or if then what happens, you will not be able to look at the other person's face. So what happens, that time you will not be able to speech read, or speech reading is not possible, like especially in situations of telephone communication, or when you are in another room, definitely you will not be able to speech read. Then distance also matters a lot. Suppose if you are very far off, then definitely you will not be able to see what movements he is doing in his lips or in his tongue movements, that and all he will not be able to do. So distance, there should be some optimal distance in which the person needs to stand in order to do a better speech reading. Lighting is also another important factor that needs to be kept in mind if you want to encourage them to do a speech reading. Now what we have seen is that when the light is coming from behind, suppose I am speaking and the other person is just facing me, so if the light is falling from behind, or if the light is coming from top, so what happens is that it creates a shadow around your face. So the other person who is sitting, even though he is sitting in front of you, he may not be able to read your lips because of the shadow that is created when the lights are on the top or from the back. So there need to be some appropriate angle in which especially the light should fall on the face of the person rather than on the top or from the behind. So lighting is also a very important factor. And other things are the visual distractors, like when you are talking something and suddenly some other object is moving in the sides of you.
जी हाँ, कॉल दे दीजिए. हेलो.
हेलो.
यस.
हाँ जी, हम झारखंड से बोल रहे हैं
जी, सवाल पूछिए अपना.
वो जो कॉक्लियर इम्प्लांट के बारे में कुछ हम जानना चाहते हैं जी.
जी बताइए.
वो जो हियरिंग एड से वो कैसा अलग है और क्यों इतना महंगा हो?
ठीक है, धन्यवाद. आपका सवाल नोट कर लिया है. अभी हम जो जानकारी दे रहे थे पहले उसको खत्म कर ले, फिर आपका सवाल लेते हैं. मिस कनका प्लीज.
Okay, so the last one, just I was telling, is the visual distractor. So anything that is coming from the, like when you are speaking and something like behind you or on the sides of you is moving, then it will definitely distract the person to look from the other side, and then he may not be able to concentrate on your speech. That is the factors. These are some of the factors which can affect speech reading.
थैंक यू मिस कनका. ये जो सवाल आया है आप उसका जवाब देंगे?
ओके. आपको जो आपने जो सवाल पूछा है कॉक्लियर इम्प्लांट, मे बी आई विल ट्राई टू आंसर टू यू. नाउ दिस कॉक्लियर इम्प्लांट, okay, how is it different from hearing aid is, this cochlear implant is basically a surgical procedure where what you are going to do is that these are normally used for those people who are having only severe to profound hearing loss. Okay, it can be used for children or it can be used for adults. There are certain age range in which it can be only given, like a minimum period of like 18 months, as young as 18, or nowadays even of 8 months of age, that the cochlear implant is given. Now what happens is that when you know that there is a hearing loss, okay, the hearing loss, the type of hearing loss that a person will be a good candidate for this cochlear implant is when he has a loss in the inner ear where the cochlea is affected, but the nerves should be intact if you want to go for cochlear implantation. So in this procedure what you are going to do is that you are going to have, if you see the cochlear implants,
call from Nainital.
okay, if you have implantation, so here you will have a microphone which is placed outside, either it can be placed at the ear level or like how a hearing aid we see BT hearing aids or body level hearing aid ke jaise it will be also looking in the appearance. But what happens is that after the microphone picks up, this particular processor jo hota hai, that is the most important part of this cochlear implantation. That is what actually costs you more. The surgery part actually if you see it may not cost you much, 1 lakh or 1.5 lakh का 1.5 लाख के अंदर हो जाता है, लेकिन the actual जो processor है that is what is going to be more important, because like unlike the hearing aid which just only amplifies the sound and gives it to the ear, this is not going to just only amplify it but also it is going to analyze the speech like how we normally hear the speech. It is going to code it into like frequency, kitne frequency जैसे and intensity and kitne में आना है, which will help us in understanding the speech. All this is going to do. So surgically what they will do, they will place some electrodes along the turns of the cochlea, so that now when you are going to speak something through the microphone, it will be now giving in the form of electrical stimulation जो nerves को directly stimulate कर देते हैं, and जो affected जो hair cells जिसको कहते हैं जो actually sounds को nerves में ले जाना है, that will not be now taken. So this electrodes will directly stimulate the nerve. एंड यूजुअली क्या होता है जब हम हियरिंग एड्स देते हैं तो इट विल ओनली एम्पलीफाई टू सर्टेन एक्सटेंट. जैसे आपको अभी 70% लॉस है, अगर आपने हियरिंग एड दिया तो वो शायद 60% या 40% तक इम्प्रूव कर देगा. लेकिन जब हम कॉक्लियर इम्प्लांट्स देते हैं, सिंस हम नर्व्स को डायरेक्टली स्टिमुलेट करते हैं, तो यू एक्सपेक्ट अ हियरिंग टू कम बैक टू ऑलमोस्ट अ नॉर्मल लेवल, अराउंड 15 dB या 20 dB में भी सुनाई देता है. तो इससे क्या होता है, we are able to hear like how a normal person is able to hear. Only thing it requires greater training.
थैंक यू मिस कनका. हमारे पास नैनीताल से एक कॉल है. जी नैनीताल से कॉल दीजिए.
बच्चा 12 साल का आता है आपके पास हियरिंग इम्पेयरमेंट लेके, तो आप अपनी ट्रेनिंग कौन से लेवल से स्टार्ट करेंगे? जैसे आप कहते हैं ऑडिटरी ट्रेनिंग,
हाँ,
कौन से लेवल से स्टार्ट करेंगे?
Okay, it is difficult at the age of 12 years to start an auditory training. We can try auditory training and make the child to listen and perceive speech, but as the child has crossed the sensitivity period, it is very difficult. If the child is a prelingually deaf child, it becomes very difficult to start an auditory training and to teach language at that age. So it can you can do a multi-sensory approach, like you can use the auditory modality, you can give a hearing aid, and you can use the auditory modality. Along with that, we can use other cues such as speech reading. You can teach the child to understand speech through visual modality also. And if the language training fails, and we can go for a manual form of communication. That is like we can teach the child finger spelling or a manual manual alphabets or sign language can be taught. But using a unit sensory approach like an auditory verbal therapy will be impossible at the age of 12 years if the child is a prelingually deaf child.
मिस कनका, आप हमें ये बताएंगे कि कौन कौन सी थेरेपीज अवेलेबल हैं?
अपार्ट फ्रॉम जो ऑडिटरी ट्रेनिंग के सिवा इसके और एक भी हैं. आई थिंक आप पीटर जी ये बता सकते हैं, ये मैनुअल फॉर्म ऑफ कम्युनिकेशंस जो हैं उसके बारे में.
Okay. The manual form of communication is the modality in which we are using the communication channels other than speech. This becomes an important, this may be the only option when if the hearing loss is identified very late. So if the child, as the previous question, if the child is coming at later age, maybe 12 or 15 years of age, it becomes really difficult to teach language at that level, at that stage. So this may be the only option. This manual form of communication mainly includes manual alphabet, that is finger spelling or sign language. And these are not preferred option, because if it is nothing works out, then only we will go for a manual form of communication, because it is a slow mode of communication. So when you speak, you can speak faster and you can perceive it, but it is really difficult to sign out faster, and it is difficult to perceive also the signs faster. And another one is the person should know the manual form of communication. The person who is signing out and the person who is receiving, both should know the manual form of communication. And there is a tendency to learn wrong grammar as only keywords are signed out. So when we sign out or when we finger spell a sentence, only keywords will be finger spelled or keywords will be signed out. So there is a tendency that the child learns wrong grammar. And the signs can vary with respect to language, culture and locality. And India is a vast country, we have different languages, different cultures, and the signs used in different locations may be different. And the distant mode of communication is not possible through signs. We can talk through oral modality in telephones, but distant mode of communication in sign language is difficult. But nowadays with improvement in optical fiber technology, distant mode of communication is also possible. And there is a dexterity problem for both children and geriatrics when you use a manual form of communication, because some of the signs used are really complex signs, and a very young child or an elderly person may find it difficult to sign out or finger spell the words. And it cannot be done if the hand is occupied. So we can do any activity and speak, but when you are to sign out, the hand should be free. So this is also a disadvantage of manual form of communication. And it is difficult to perceive emotions through manual form of communication. So through this speech we can perceive some amount of emotions, and through finger spelling or through signing out we cannot perceive the emotions. And the person's attention has to be drawn before signing out. That is also another disadvantage of manual form of communication. There are different types of manual forms of communication. The first type is called as systems which are parallel to spoken language. This includes the finger spelling. So this in finger spelling, every alphabet which is spoken is spelled out. So this finger spelling can be done using single or both handed, and we can perceive around 300 letters per minute or 60 words per minute through finger spelling. Okay. The advantage of finger spelling is that it can be learned faster. So if you use English as a language, so if you know the signs of 26 alphabets, you can sign out any word in the dictionary. And the disadvantage is that it is a slow mode of communication, because you have to spell out each word, each letter by letter. So this becomes a slow mode of communication, and it cannot be taught to young children who don't know the spellings. This is also a disadvantage of finger spelling. And the next method is an interactive method. This is called as cued speech. So this makes use of 8 hand shapes and 4 positions along with speech. So the positions are at the level of lips, mouth, throat and chin, and the person looks at the lips, the hand position and the place to understand the speech. So this is called as an interactive method, because we use speech along with the manual form of communication. And the next method is an alternative method, that is a sign language. We have Indian Sign Language. This makes use of simple hand shapes and movements. So there are hand shapes and movements, and we can use it with a single or both hands. Some of the signs can be done using single hand, and some of the other signs can be done using both the hands. It can be used in combination with the finger spelling also. So if there is a word which doesn't have a sign, so that word can be spelled out. And there is a manual for Indian Sign Language, an introduction to Indian Sign Language focused on Delhi, and it has got line drawings of words. And the dictionary for Indian Sign Language is published in 2001.
थैंक यू पीटर. मिस कनका, आप हमें बताएंगे कि जो हियरिंग इम्पेयर्ड बच्चे हैं उनके पेरेंट्स के लिए भी कुछ प्रोग्राम है, उनकी ट्रेनिंग के लिए या फैमिली मेम्बर्स के लिए?
हाँ, देखिए अब once what happens is that once like we take the child for therapy, now that the time that they come and spend with us is actually very much less. They may hardly spend either a 45-minute session or 1 hour session. Now the most of the time that they are going to spend is only at home. So it is always necessary that we give home training. That is, we are going to give some activities to the parents so that they can carry it out home, and that is what is more important than like we only sitting and giving therapy. But sometimes you have seen parents like because they just want to shed off their responsibilities, they would just leave the child in the therapy session, and they will like tell like expect us to teach them everything from A to Z. They expect us to teach, and they will also complain that my child is not improving. So it is always necessary that we have to involve parents whenever possible, like to sit in the session, and slowly what we have to do, we have to train them in such a way that they take over the therapy of the parents. Now as I told you, only 1 hour or something that they spend here, so we have to give them activities at home. So this is also called as the home training, which is very important. Now the aim of giving a home training is basically is that whatever we are going to teach them in the therapy session, that activities can be generalized and it can be stabilized at home. And many times like 45 minutes the child may not be cooperative, or the child may cry during that time, and all the activities may not be possible to be carried out in that particular hour. So those activities which cannot be done at home can at the therapy session can be taken at home. And this helps in making the progress also faster, because we are also stimulating and the parents are also stimulating the child. So the progress that you are going to achieve would going to be much faster. Only thing, the parents need to be counseled very strictly that they have to follow the activities. Now it can be done in different ways, like normally what we say, if they are coming regularly for therapy for like so many months they keep coming for therapy, but still we have to do whatever the activities that we are carrying it out for that day should also be carried out when they are going home, so that next day the child is prepared with that activity. Okay. And also you can give, suppose some people they come from far places and they just stay for 1 week or 2 weeks. So in that kind of cases we can give them demonstration therapy. So demonstration therapy may we will be demonstrating to them the activities, but we will give them a written material of what all things that can be done at home, and we will tell them you come back after a month or 2 months depending on when they are telling that they will report, and we will tell them to note down whatever the activities that like the child has shown improvement. Apart from this, correspondence courses are also available. The most famous of all that is the John Tracy Clinic, which is based in US. They send the lessons on request, the address of which is we are showing you here. That also can be given, but it is important that the home training is done more than the training that is given in the therapy session.
थैंक यू कनका। एक सवाल जो अक्सर हम लोगों के मन में उठता है कि एक छोटा बच्चा जो है जिसको हियरिंग इम्पेयरमेंट है, उसके लिए आप किस तरह की एम्प्लीफिकेशन डिवाइसेस प्रिस्क्राइब करेंगे?
Okay. Now the amplification devices, okay, that we normally like recommend for young children is that we have different options. Like nowadays, since the technology has improved and all, we have either hearing aids as an option or cochlear implants as an option. Now when you say hearing aids, there are different models of hearing aids that are available. So like the common one that we see is body level hearing aid or BT hearing aid. So since we are telling it's a young children and we need to do an early management, preferably we prefer 2 hearing aids to be given to both the ears, and BT hearing aids are preferred much better because of its like the location of the microphone, which is mainly at the ear level it is located. So like how we hear the normal sound at the ear level, even the child who is wearing the hearing aid also will perceive the sound at the ear level. We will not recommend them to go for IT hearing aid or ITC, like many people will ask कान के अंदर डालने वाला दो, like which is inside the ear, which is not seen, so that my child is not hearing impaired. So that kind of hearing aid we normally do not recommend for children at least till 7 to 9 years of age, because during that process of development till 9 years at least it will take for the ear canal to size and the shape will change for the child. So giving a hearing aid which is in the ear, then you may have to change every 6 months, or like whenever that child will not be able to feel comfortable, and the hearing aid may also fall off from the ear because the ear canal will be straight till that period, and later it takes a shape of S, which will also help them in retaining. And most of the children, if you see, they will have congenital hearing loss. So the loss will be usually profound and all, and these kind of small hearing aids that we see, even though technology has improved in terms of like the small amount or the size of the hearing aids are reduced, but the degree of amplification that you give will not be enough. So preferably BT and body level that we can give, preferably to both the ears. Cochlear implant options is also available, provided if you are financially or able to support it, then it is one of the best options that we can recommend it for.
थैंक यू कनका। मिस्टर पीटर, क्या जो मैनेजमेंट प्रोसेस है वो इसके ऊपर डिपेंड करता है कि बच्चे की एज क्या है, किस उम्र में हमने उसका आइडेंटिफिकेशन किया है?
Yeah. The management procedures depends upon the age of identification of hearing loss. So if you identify the hearing loss earlier, however the degree could be, you can go for a better management options like auditory verbal therapy, okay, which is a unisensory modality, unisensory approach. If the hearing loss is identified a little later, then the auditory verbal therapy may not be sufficient. So we may have to supplement through other modalities other than auditory modality, that is through speech reading or any other multisensory approach. So if the hearing loss is identified still later, maybe an adult with a hearing impairment, it is very difficult to teach language through even with a multisensory approach. We may have to go for a manual form of communication, that may be a finger spelling or sign language.
थैंक यू पीटर। कनका, आप हमें ये बताएं कि जो एक स्कूल, नॉर्मल स्कूल में अगर कोई हियरिंग इम्पेयर्ड बच्चा पढ़ रहा है तो उसके टीचर्स के लिए आप क्या मैसेज देना चाहेंगे? समय हमारे पास बहुत कम है, एक शॉर्ट में आप जरा बताएं।
पहले तो हम उनको उनका क्या प्रॉब्लम्स होता है हियरिंग इम्पेयर्ड का, उसके बारे में हमें बताना है और उनके लिए कोई टेक्निक्स बताएंगे, जैसे उनका सीटिंग अरेंजमेंट कैसा होना चाहिए। उनको हम बताएंगे कि आप बोर्ड्स ना इस्तेमाल करें, बोर्ड्स इस्तेमाल करें लेकिन आप लिखते वक्त आप मुड़ के रहते हैं, बोर्ड को देखते हैं, तो वैसे नहीं करना चाहिए। आपको हर बार जहां बच्चा बैठा होता है उसकी तरफ देखना है। ज़्यादा आप मॉडल्स यूज़ करें, चार्ट्स इस्तेमाल करें, ताकि ज़्यादा विजुअल क्यूज़ आप दें। आप या किसी बच्चे को, उनके फ्रेंड को आप बता सकते हैं कि आप उनके लिए नोट्स लिख के दे दें, या पहले ही बताएं कि आप क्या सिखाने वाले हैं, ताकि वो बच्चा प्रिपेयर्ड रहे कि अच्छा आज मुझे क्लास में ये पढ़ाया जाता है। तो ऐसे चीज़ें को कैसे टीचर्स बातें करना चाहिए जो हमने पहले बताया है, थोड़ा नॉर्मली, नेचुरली, थोड़ा रेट थोड़ा कम करना चाहिए, जैसे वैसे सब आप करने से इट विल बी यूजफुल। एंड यू शुड बी ऑलवेज कीपिंग इन टच विद द पेरेंट्स एंड द प्रोफेशनल्स ऑल्सो टू टेक मोर हेल्प फ्रॉम देम।
थैंक यू कनका। अंत में मैं अपने दर्शकों को बताना चाहूँगी कि हमारी अगली टेलीकॉन्फ्रेंस का विषय रहेगा इंटरवेंशन एंड रिहेबिलिटेशन ऑफ मेंटली रिटार्डेड चिल्ड्रन। समय वही 11 से 12 बजे तक रहेगा। मैं अब इस टेलीकॉन्फ्रेंस से जुड़े अपने एक्सपर्ट्स, अपने व्यूवर्स, ईएमपीसी के सभी कर्मचारियों और आरसीआई के अपने सहयोगियों का धन्यवाद देती हूं, जिनके सक्रिय सहयोग के कारण ये कार्यक्रम सफल हो सका। जब हम इंटरवेंशन की बात करते हैं तो हमें लगता है कि जिस तरह से एक्सपर्ट्स बताते हैं, पेरेंट्स को उस प्रक्रिया में लगे रहना पड़ता है, बच्चे को लगातार सिखाना पड़ता है, और अगर हम उन कदमों का ध्यान रखें तो हमें सफलता ज़रूर मिलेगी। और इस वक्त मुझे रामकृष्ण परमहंस की 2 पंक्तियां याद आ रही हैं, एज लॉन्ग एज आई लिव सो लॉन्ग डू आई लर्न। थैंक यू।